Hey there everyone, hope you have your VR goggles on because this is the virtual reality Hales Parker Dentistry video. Dr. Parker, Dr. Hales here, and today we're going to be talking about sedation dentistry. Dentistry causes a lot of anxiety for patients to have to go through, and luckily there is lots of options out there for the anxious patients or the patients that have to undergo lengthy procedures and making that better for them. So there's different levels of sedation, and the reasons that you would look at these different levels are length of procedure that you're having done, the history yourself as far as dental anxiety and experiences for you. And then a final thing to look at is medication use or drug use and how that affects your body. That will determine your susceptibility to the sedation medications that we utilize and determine which one is going to be best for you. So Dr. Hales, talk to us about kind of the lightest or maybe entry-level sedation that patients can achieve or get.
Yeah, so I would say a majority of our patients are pretty anxious.
Right.
And so we use some kind of sedation on most patients. So don't feel like if you do have a fear of the dentist or you're very anxious that you have to worry, because these are what they're there for, okay? Mm-hmm. To help take care of you and help you feel comfortable when you come in. So the lightest one is what we call nitrous or laughing gas. So a lot of people love it, and we use it a lot with kids. It just kind of helps calm the nerves a little bit. So you don't really fall asleep, you don't really pass out at all, but it helps you feel relaxed that you can get through the procedure, and it works really, really well with kids.
Yeah, adults it's a little more unpredictable,
mm-hmm.
And so not exactly the go-to for an anxious patient, but for someone that wants to feel a little less anxiety and just a little bit careless about what's going on, it's a good option.
Mm-hmm. Yeah, and I wouldn't say it lasts too long, right? Usually you can get maybe 1 to 2 hours with it, so I usually want more of the shorter procedures.
Yeah, and you don't need a ride as well.
Right.
You can drive yourself to and from the office if you've had laughing gas, so that's also a positive or plus with that. Yeah.
So if you have a longer appointment or you have a history of drug use, what are some other options where you could more fall asleep?
Yeah, so the next level above that would be oral conscious sedation. This is where we're utilizing a medication, and we utilize medication in the benzodiazepine family, and so those are anti-anxiety medications. And what that will do is that will get you more drowsy. Not all patients will fall asleep with the medication, but what it does is it produces a very drowsy effect and also has an amnesia effect. So if you're going to be in the office for a lengthy period of time, or if you're anxious and don't want to really recognize that you were at the office, at the dental office, this is a good option. You will need a ride to and from, because there are lingering effects. So you're going to go home and still feel drowsy and sedated. So not exactly like you're popping back to work after doing this, but this is the type of sedation that we use most for adults that are undergoing any sort of procedure over 2 hours, and we find that a lot of patients really like it, and it's extremely safe. It's very, very well utilized in modern medicine, and so it's an extremely safe sedation method to do.
Yeah, it's really nice. If you don't want to remember any of the part of coming to see us, then it's a great option, right? And you kind of sleep through it, so it makes our job a little easier too.
Yeah, right.
So, but then we have some of those super high anxiety patients where they still, just that medication isn't strong enough for them, and that's where you want to do IV sedation. And so that one, we actually have an anesthesiologist that we have come in, and they he's in charge of giving you all the medications that you need, and that's where you are put under, or where they fall asleep, and you do not wake up until he makes you wake up. So it's really good because he has full control over keeping you at the perfect level of sleepiness until we're completely done with the procedure.
Yeah, typically we're utilizing this method of sedation for our really lengthy cases, like 4+ hour cases, or large surgical cases where we're removing a lot of teeth and we're placing a lot of implants, or also doing a lot of crown and bridge work in the patient's mouth, because this allows you to be completely zoned out the entire time and have as comfortable experience as possible. It is also more expensive because you're paying for that anesthesiologist and his expertise and his skills to perform that procedure for you. But when the time calls for it, or if a patient has a history of medication and drug use that is extensive, that's really going to be the only option available to them.
Right. Yeah, and I mean it goes from lowest, from laughing gas up to IV sedation. Cost goes from cheaper to more expensive as well.
Right.
So,
but it makes your visit so much better, your experience so much better, and the outcome typically better as well. So do not hesitate to ask about sedation options with your dentist, and really do yourself a favor and make it a better experience for yourself.
Yep, it's a great time.